Who should consider MRD testing, and when should it be done?
So minimal residual disease is assessed at the time when the patient has a complete remission. So your blood and your urine and your free light chain should be indicating no evidence of active myeloma. Then the question is there a residual disease in bone marrow? So at that time, we will obtain a bone marrow sample and we will send it for analysis.
The common question is, when should MRD testing be conducted? There are no guidelines that state that it must be done at any particular situation. There are guidelines, international and national guidelines here in the United States, saying that if the doctor and the patient are in agreement, it could be done virtually at any stage during the treatment of the disease. It could be done after completion of combination therapy. It could be done after transplantation for those patients who undergo transplant. It could be done after, for example, a year of maintenance therapy, and it could be repeated annually. It could also be done after completion of therapy for relapse disease. So there is really room to interpret these guidelines in very many different ways. At our center, we would do MRD testing after completion of combination therapy. And for patients who undergo transplantation, we would do it again. And we would also do it, we would offer patients to do it once a year on maintenance. For patients who have a relapse, if we treat them with our best therapies that we always would offer, we very frequently see patients reaching very deep responses with the blood tests. For those patients who go into complete remission, we would again offer MRD testing the same way as we would do for newly diagnosed patients.
The question of when should MRD testing be performed is complex. I think the short answer is that it's not quite ready for prime time in routine practice for many, many reasons. One of the biggest reasons is that it's not standardized. If you get MRD testing in Heidelberg, it's not going to be the same as in Chicago, so it cannot be compared. It is not ready for prime time in routine practice. It is now being done routinely in clinical trials. So in general, I would say we're not quite there. If you're in a clinical trial, which I strongly encourage all patients to be in clinical trials, you probably will have high-level MRD testing. So it's still, studies are still underway. When should MRD testing be done is a great question. It depends on the technology that you're using. There's two major forms of technology. One is called flow cytometry, which can measure cells down to, we can find one abnormal cell or one bad guy in 100,000 normal cells. That's amazingly good. When you use another technology called next generation sequencing, which is a genetic test, we can identify one bad cell in 1 million cells. What we've learned is that the MRD status changes in many patients over time. So if we are to use MRD testing, we're going to need to check it again and again. And at least for now, that's going to require repeated bone marrow aspirations.